My name is Michelle Sierant. I'm one of the physician assistants at Michigan Neurology Associates. Today we're going to be talking about sleep apnea in adults. Sleep apnea is the most common sleep-related breathing disorder. It is defined as a disorder because of impaired breathing linked to the sleep state. It is characterized by episodes of shallow breathing and/or absent breaths limited to sleep due to repetitive, partial or full collapse of the upper airway. Sleep apnea is divided into obstructive and central sleep apnea. Obstructive sleep apnea is difficulty in breathing due to narrowing or closure of the throat, while central sleep apnea is difficulty in breathing from a decrease in the brain's drive to trigger the next breath. Without adequate management and treatment of sleep apnea, it can lead to dangerous consequences. It's important to note that millions of U.S. adults are diagnosed with this disorder, and the prevalence is increasing. In North America, it affects up to 30% of males and 15% of females. Risk factors for developing sleep apnea include older age, being male, obese, and having upper airway abnormalities, such as an elongated soft palate, deviated septum, enlarged uvula, tonsils, and adenoids, and a small or receding jaw. Signs and symptoms of sleep apnea include a range of impairments that affect one's quality of life and, even more importantly, their safety. One sign of sleep apnea is snoring. Snoring is the sound made by the vibrations of the soft tissues of the upper airway as it narrows during sleep. It can indicate upper airway resistance, which may indicate obstructive sleep apnea. Similarly, gasping, choking, or startle awakenings during sleep is concerning for sleep apnea. Other signs and symptoms include daytime sleepiness, requiring frequent naps during the day, falling asleep while at work or while driving, feeling unrefreshed upon awakening, morning headaches, and waking up with a dry mouth. Even impairments in memory or concentration can be indicative of underlying sleep apnea. It is important, if you are having these symptoms, to be evaluated for sleep apnea to ensure your safety and improve your quality of life, including for those around you. Screening for sleep apnea is typically done through a questionnaire rating how sleepy you feel during certain activities, which is the Epworth Sleepiness Score. If you score high on this and your clinical history and physical exam are concerning for sleep apnea, a sleep study test may be ordered. This test is used to diagnose sleep apnea. Testing can be done at home via a portable unit or completed in a more monitored sleep lab setting. In-lab studies tend to be more accurate, provide more data, and have a technician available to help with any issues. The diagnosis of sleep apnea is based on the AHI, which stands for the Apnea-Hypopnea Index, which quantifies the number of times per hour breathing stops or partially stops while sleeping. If the AHI is greater than or equal to 5, it is a diagnosis of mild sleep apnea. An AHI greater than or equal to 15 is moderate, and an AHI greater than or equal to 30 is consistent with severe sleep apnea. Untreated obstructed sleep apnea increases the risk for cardiovascular disease, including hypertension and heart failure. In addition, undertreated obstructive sleep apnea may be an underlying reason for memory impairment and inattention. It also has been found that untreated obstructive sleep apnea leads to higher rates of motor vehicle accidents. Overall, adequately treating sleep apnea will improve one's quality of life and safety. Depending on the severity of obstructive sleep apnea, different management options are available. In general, we recommend avoiding sleeping in the supine position, as well as alcohol and sedating medications, as this can worsen sleep apnea. In addition, if indicated, weight loss can be helpful in reducing the severity and in some cases can even be curative. The mainstay treatment of obstructive sleep apnea is positive airway pressure therapy. This includes a mask with tubing connected to a machine that provides air pressure to splint the airways open while sleeping. This includes CPAP, continuous positive airway pressure, and BiPAP, bilevel positive airway pressure. BiPAP has 2 pressure settings for when you inhale and exhale, while CPAP delivers continuous airway pressure. For both, there are numerous different mask options available. Those that cover both the mouth and nose, mouth only or nose only. Generally, if the mask is fitted properly and the air pressure is optimized, CPAP has a 95% efficacy rate. For mild and moderate obstructive sleep apnea, some patients can consider an MAD, mandibular advancement device, to treat their obstructive sleep apnea. It's an oral appliance made by a dentist specialized in sleep that helps move the jaw and tongue forward. Other options include hypoglossal nerve stimulation via a pacemaker-like device known as Inspire. A surgical referral to a surgeon to address other upper airway abnormalities may be helpful. For those that have a prior diagnosis of obstructive sleep apnea, it may be time to retest. If you've had recent significant weight gain or weight loss, worsening of symptoms with no recent sleep tests, or continued breathing issues during the night. Sleep apnea is the most common sleep-related breathing disorder and has numerous negative consequences if left untreated. However, we are able to easily diagnose and treat this condition, which can significantly improve patients' overall health and quality of life.